More and more healthcare workers are speaking out about concerns as we head into the fourth wave of the pandemic. Overcrowded emergency rooms and ICUs, burnt out staff, and hundreds of thousands of eligible people still unvaccinated. Joining me now is Dr. James Stempian. He's an ER doctor in Saskatoon, but he's also the provincial head of emergency medicine with the Saskatchewan Health Authority. Thanks for being here.
Happy to be here.
First question, simply put, what is going on?
Well, in terms of the emergency department, there's increasing stress in the emergency department, increasing staff burnout. We're having high numbers come through. We've always had high numbers in the emergency department, and there's been a bit of a chronic problem with admit no beds, but it's never been this bad before. We'll go into the emergency department. I'll start a shift, and every bed will be full of admitted patients, and we're seeing our patients out of the waiting room. I think it's something that is part of the normal stress of the emergency department, but certainly exacerbated by this recent fourth wave of the COVID pandemic.
We've heard Saskatoon ERs are packed to the brim. Central and northern ICUs are on bypass to Regina. What can you tell me about the current situation of acute care hospitals in our province?
Yeah, they're under a lot of stress. If you can imagine, I think the people working in the emergency departments, they love working in the emergency. That's why they're there. But the last year to 18 months has been very stressful. People have been, just the whole idea of wearing your mask all shift long and the PPE and having to change and the change in the way we normally function. People picking up extra shifts, working long hours, denying themselves days off so they can work in the ER. But there's a certain period of time where people can only do that for so long. And I think people are getting burned out, getting stressed. And now we're seeing that, that increased wave of people coming in again with, the COVID positive patients, but it doesn't really have to happen, right? So there's the 75 to 80% of the people in our ICUs now are the non-vaccinated. They stay longer. They stay average of 4 or 5 days longer than if a vaccinated person ends up there. And it's just kind of stressful and kind of difficult. So most of our shifts were down our regular nursing capacity. Makes it difficult to see patients, makes it difficult to give proper care. Last couple of shifts I've seen all my patients out of the waiting room, and some very sick patients out of the waiting room. The sicker patients, the CTAS-2s, who should be seen in 15 minutes, we get a page. Last three I saw were all out of the waiting room, people with chest pain that should have had a bed, and there's just no bed to be had.
How does that feel as someone who's been a doctor as long as you have to be in this situation?
Yeah, it's tough. It's certainly one of the hardest, most difficult situations in the ER I've seen, and I've been working in Saskatoon since 2007 and 35 years overall. So yeah, it's tough.
We've been hearing healthcare workers are feeling a bit abandoned and want more support from the government. From your vantage point, what would more support look like right now?
I think from a personal point of view, from a ER physician point of view, I think the mask mandates would be important, and emphasis on vaccinations. Again, I think a lot of people are trying to say that the unvaccinated people are trying to say it's a personal preference, whereas in my point of view, it's really an obligation to society. You're protecting society, you're protecting your community by getting vaccinated. When we're seeing unvaccinated COVID patients come into the ER, everybody gets the best care we can give. But that also means that some people elderly people with abdominal pain, the chest pains that I was referring to, if I can't put them in a bed, they're not getting the care that they should get. So I think pushing vaccinations as much as we can, making people realize it's societal obligation to protect your community, and I think getting back to those mask mandates that other provinces are going to.
Thanks so much for your time, Dr. Stempian.
All right, you're welcome.
Dr. James Stempian is an ER doctor in Saskatoon and the provincial head of emergency medicine with the Saskatchewan Health Authority.